topic that I'm going to cover today sounds so simple. Immediate socket placement, or dealing with the socket when you take a tooth out, is something which we do every day, and this has happened since the beginning of mankind, taking a tooth out. The question is, what happens to the socket after you take a tooth out? Is this a little, could you lower it down a little? What happens to a tooth after you take a tooth out? It sounds so silly. Here we are in 2013, and we have to discuss what happens to the dimension of a socket after an extraction. This is something which is amazing to me, because the literature is very controversial about this. And you're going to see presenters during the next 2 days, good friends of mine, of course, who will talk about different techniques to fix problems. And my topic today is going to be some new research that we have done with some multi-center study to discuss what happens to a socket when everything is there when you take the tooth out. Meaning the bone is there, the pillar is there. How do you preserve it? Can you preserve it? Now let me ask a simple question. When you take a tooth out, does alveolar ridge resorption, and you see obviously changes in the bone and changes in the tissue. We've all experienced this. Now the question is how much? And also, does alveolar bone resorption continue throughout life? It's a simple question. Does alveolar bone resorption continue throughout life after an extraction? How many of you would say yes? How many of you would say no? How many of you are afraid to raise your hand? No. York said I can do this with you. York told me it's okay that I can take you back to school. You think you're going to put the lights up a little bit, because I see that it's a little like they feel that they can sit in the dark. No. I need you to commit. I need you to know you're all dentists. Almost all of you are dentists. And you take teeth out. Or you have somebody else take teeth out. You must know the consequences of it, whether you're doing the restorative work or whether you're doing doing the surgery. So I ask you a simple question. When you take a tooth out, we certainly know there's changes in the socket. We will discuss that. The question is, after the initial remodeling, let's say a few months, does alveolar ridge resorption continue throughout life? Do you see alveolar resorption continue throughout? How many people say yes? How many people say no? How many people are afraid to raise their hand? So, most of you said alveolar ridge resorption does continue throughout life. About 2/3 of you said that. Well, that's sometimes true, and we all know that. But is it always true? The answer is no. What happens if I fell right now and I lost, well, let's take a look. Let's say you're going to be a first bicuspid, you be a second bicuspid, you be a first molar. Okay. Now, unfortunately, my moderator is gone now. Coke out, you're gone. Okay. He just fractured. That's good. Goodbye. After that Wikipedia discussion. Okay. So, the problem is my old dentist, even though I liked him, I never had anesthesia. Oh. I had to hold on to the chair, you know, and do this. But what happens if you don't do an implant, and we take him out and we make a 3-unit temporary? Whatever type of retainers you want. But you make a 3-unit bridge of some type, a temporary bridge. How long do you wait? If you're a student, you wait 6 weeks because you want to finish your case. But I would say probably about, 12 weeks is fairly normal in the world to be able to wait about 3 months, wait for the socket to fill in, wait for the remodeling a little bit, and then you take an impression of your ridge. You take an impression of your ridge because you know that that's basically what you're going to give to your technician and get it back with the pontic, whatever pontic you decide. And then if alveolar ridge resorption continued throughout life, every pontic would have a space underneath it with time. Now that sometimes does happen, but that's not typical. It's not every day. So I challenge you to raise your hand. What you were thinking about is the classic works by Tallgreen and Holmes and everything else about classic alveolar ridge resorption. That's what happens when you take teeth out and you put a denture on top and watch it for 25 years. That's what we've both seen with our denture patients, and that's why we think it continues throughout life. That is the biggest neglected area that we've not attended to properly